Hey guys, I'm Nick from Active Chiropractic. I'm being asked quite a lot about shoulder problems and weakness in the arm and basically rotator cuff problems as well. And I think there's a common muscle that keeps reoccurring, that I keep seeing, is that it's actually the infraspinatus muscle. Now, the infraspinatus muscle is a rotator cuff muscle, and it's actually attached from the lower part of your shoulder blade to the outside of the humerus. And what the main purpose of this muscle does is basically it externally rotates your arm, like so. Okay? Now, basically, the main problem that actually causes this muscle to spasm or go weak or fatigue and bunch up and gather heaps of what we call knots or trigger points is due to just general habit. For example, working at a desk for a long time, or the way we sit and watch TV, or just basically, or driving as well. So, for example, when we work, we tend to just slouch ourselves and lean forward and look at the computer and type, or we just work like so. Okay, so we slouch and bring our shoulders forward, or driving and bring our shoulders forward as well. And basically, we contract the chest muscles, and they become a lot more stronger, or they just seem to be used a lot more than you actually the infraspinatus muscle. So you can understand the infraspinatus muscle is quite a small muscle, so it's completely all the time fighting these two big muscles on our chest, and they get fatigued and weak quite easily. Now, when these muscles fatigue, the pain actually gets referred, instead of actually getting pain there, pain is referred to the attachments around here, or outside of the shoulder, or sometimes even in the front of the arm. Now, other issues that can fatigue these muscles, or strain these muscles, or injure these muscles are also overhead exercises that require us to pull up, for example, chin-ups. But the problem is, sometimes when we do chin-ups, it's fine, but then we drop ourselves, and it actually pulls the muscles and strain it. Now, you can also strain it by doing rows as well. And we do the rows fine, but then we let the weight strain our infraspinatus muscle. And that causes a lot of strain, and it could even cause injury. And it spasms and it causes pain. So what we can do is I'm going to teach you few things that you can do at home, the massage and strengthening exercises. You can use, what I use is a lacrosse ball, because it's grippy and it holds the spot well. You can use a tennis ball, or you can use a cricket ball as well. So what you do is you find the muscle here. It's just on the lower bit of your shoulder blade. It's quite big. So you put it there, okay? Put it against the wall. You can do this on the floor as well. And you get into a really tight position, usually just at the tip, on the outer edge of your shoulder blade. You add a little bit of pressure, and you just hold it there. And right now, I could feel that pain right here, just in front of the bicep. Sometimes I feel it on the other side of my humerus, and I hold it there for about 8 long breaths, or even 20 seconds. And I do 3 sets of those, about 3 times. Now, to really accentuate the deep massage, what I can do is a type of myofascial release. It's basically doing the movement of the muscle and adding pressure onto it. And that basically adds a deeper type of massage as well onto the trigger point. Trigger points usually are little tiny nodules where you add pressure on it, it actually refers pain. You will know how it is. It takes a bit of practice. And you can also rearrange the ball and find another trigger point. Sometimes there's 2 or 3, sometimes there's more, sometimes there's only 1. What you can also do is you can use a foam roller. Put a foam roller on the ground, lean on this back, and then roll into the trigger point area. The same deal with that as well. You hold it for 20 seconds or 8 long breaths. Now, don't try to hurt yourself. It should be just a quite relaxing pain. It's not exactly something that you would hate to do. Make sure you do both sides. Sometimes one side might need a bit more attention than the other. Now, a strengthening exercise as well is you can use a thera-band or even a dumbbell. So if you were to use a dumbbell, imagine this is the floor. You lie on the floor, okay, on your side. have the dumbbell on one arm, on the outer arm, and you're pulling the weight up, and you're holding it for about a second, and nicely slow it down. You do about 8 to 10 reps of those, about 3 times. Now, it should be a straining kind of exercise. It should be just a bit of a strengthening exercise. It's just working the muscle. Otherwise, you might strain it even more. Now, the thera-band, what you can do is you can get a cheap one from your local sports store, even large supermarkets, large superstores. They wouldn't have thera-band anyway. And basically, find a pole or staircase or wherever you can find at home, and you have it, and it's an external rotating muscle. So you go from here, and you externally just rotate your arm outwards. You do it nice and slow. Okay, try to keep your elbow nice and tight into your body, and pull it out. Okay, make sure you get a nice soft thera-band. This is quite strong in itself. You do about, once again, 8 to 10 reps of those 3 times. Now, if you do find that you're having a bit of weakness at work or wherever you're doing you can do a Bragger's, it's called Bragger's relief position. So basically what we do is we tend to slouch forward, right? We our head forward with our arms forward. So this is loose and this is tight. So what it does is it strains the muscle. So what we do is we open up our chest, okay? Open our arms, externally rotating. Bring our chin up and hold it there for about 20 seconds or 8 deep breaths. You can use the wall to guide yourself as well, or even a pop, like so. Pull your chin back in, okay? Chest up, and open your shoulder blades as well. And you squeeze the shoulder blades together, open up your arms, and you're tensing all the muscles that are opposing the chest, like slouch so. And that basically strengthens the muscles that we're trying to oppose your slouching position. So slowly, if you do this after about a month or 2, you realize you get a little bit less headaches, or your arms are not as weak or dull anymore, and your posture is actually better as well. So it's a good idea to do that. So I'll leave you with that. If you have any questions, or even tell me how the exercise went for you, or how I can improve this video or whatever, just leave your comments or email me or whatever you feel like, and in my spare time I'll look at it and try to reply to you. Thanks guys.